Worth Hospital Council.
Thank you, Chris, and we want to thank all the folks that have joined us today. Ladies and gentlemen, this webinar is beginning. We do apologize that due to technical difficulties with the platform we use for webinars, that we had to postpone the original, but today is going to be great. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. We're delighted this educational webinar is hosted in coordination with Critical Insight, who's an associate member here at the Hospital Council. Today, the topic is ransomware in healthcare. Prepare, detect, and respond. For over a decade, Critical Insight has defended their clients' assets to help them achieve their mission. It's a world-class information security team, and they do managed detection, response, vulnerability detection, and cybersecurity consulting services. They specialize in the protection and defense of healthcare organizations. We're delighted that we've got with us today Jake Milstein, and we also have with us guest speakers, John Delano, who's the Vice President in Ministry and Support of CHRISTUS Health right here in Irving, Fred Langston, Chief Product Officer at Critical Insight, and as I mentioned earlier, Jake Milstein, who's the Chief Marketing Officer at Critical Insight. You know, we were talking before we began this webinar, and I think a rural hospital in West Virginia is one of the latest victims of ransomware. Attacks against healthcare companies continue to increase. Valuable hospital data is very vulnerable to cyber hacker attacks. 66% of healthcare organizations were hit by some ransomware attacks last year, which represented a 34% increase since 2020. So we know we need to learn more about protection and what we can do related to these dangerous attacks that actually can result in negative outcomes for patients. We look forward to the presentation. One administrative item, there's a question box and a chat box. Either works well if you have a question. And then once the presentation is over, we'll go to our experts to answer those questions. With that, it's my pleasure to introduce to you Mr. Jake Milstein.
Thank you for that great introduction. We really appreciate you inviting us to do this twice. Once last week when it didn't work, and then we're back today. And we're glad that the webinar platform is working today. So thanks very much for inviting us. You know, when we were talking earlier about that West Virginia hospital that got hit by ransomware and is not able to deliver care to patients, you know, it's more than just an IT problem. It's more than just a security problem. It is infuriating. And the reason that we're in this is to battle the bad guys and keep patient care going as it should be. So today what we're going to do is we're going to talk about ransomware in healthcare, how to prepare, how to detect, and how to respond. And the way we're going to do it is we're going to talk through the NIST cybersecurity framework. And if you're not familiar with the NIST cybersecurity framework, you're going to get familiar with it today. If you are familiar with it, what we're going to do is talk about how healthcare organizations should be looking at the NIST framework. And by the way, since we first came up with this presentation, first came up with this idea, the government has said, hey, healthcare should pay attention to NIST framework. So if there's a lot that's happened around NIST. So who are we? Critical Insight defends critical services against cyber attacks. Our customers are hospitals, other healthcare organizations, some benefits organizations, and it is our mission to defend those critical services against cyber attacks. As mentioned, John Delano's here. He's at CHRISTUS. He used to be at Advent Health. Fred Langston, so Fred is the chief product officer. Fred's also one of the founders of the company, and Fred has spent decades consulting healthcare organizations. He was involved in the HIPAA security rule, and Fred's going to be leading the talk about NIST today. And what we're going to do is, as we talk through it, John's going to talk about how it gets applied in organizations. And then I'm the event host. We love questions as we go. Please put questions in. One of my favorite things to do is interrupt Fred and John with questions. And so as I hear stuff from them, I'll interrupt them. And then, we look forward to your questions as well that the council will bring up. All right, there are three things to know to start this. Number one, it's about lowering risk. Risk will never be zero. We have found out the hard way that the bad guys will always find a way to get in. A determined criminal will get in. There is no way to determine it. There is no way to get the risk to zero, and that's unfortunate, but it is a truth. And when I talk to hospital boards, sometimes we might spend a half hour just on why you can't get risk down to zero. A risk assessment, if you don't do one every year, and you should obviously, and it's mandated that you do, you should get a good one every year, because that sets your priorities and how you can lower your risk. Those are three really important things to start. Fred is going to take it over here and start going into NIST.
You bet. So what we're going to talk about is why you should care about NIST. Obviously, the government is telling you should. Why is that? And when we go over each component of what the NIST framework includes and how you can use it to minimize your ransomware risk, and probably equally important when it happens, how to recover rapidly from that unfortunate event. So we're going to talk about all the stages in the process that the NIST cybersecurity framework includes. And as I go through these, John will help us by giving us some color and some of his own experiences and his own opinions on what these things mean. So the reason this is important to think about this, well, NIST was created, the cybersecurity framework, for critical infrastructure. Healthcare is specifically defined in the US government emergency management as a critical service. So this is built for you, right? This was not built in isolation. This really was meant to provide the right kind of guidance for people that have to be running all the time, 24/7, or at least have very critical life function in our society. So it's built for you. It's the most widely used security standard. I come from a background, as Jake mentioned, I was on a working group that contributed to the HIPAA proposed security rule back in the mid-90s. It was great at the time. It doesn't cover everything that you need to protect your organization. The NIST cybersecurity framework you can apply across your entire organization. HIPAA is talking about EPHI, systems that store and process electronic health records. So you need to step beyond those boundaries that HIPAA is kind of unfortunately inadvertently set up, and say, I need to look at the parts of my organization that are also a threat to healthcare and provision of care and data. In other words, if they can get a control of our HVAC system, they can potentially attack EPHI containing systems and launch ransomware. Or worst case, they can just shut down if you're in a hospital facility, if you turn off the HVAC system, you have shut down operations at that facility, right? So there's a lot to be thought about on the periphery of your organization that HIPAA is not going to push you to assess. So that's why we really recommend people take this broader look, all the other things that are IT components that could eventually cause a healthcare loss of ability to provide service or compromise of patient data, right? So that's why this is really important. And it gives you an enterprise view of security and data, rather than, again, kind of tunnel visioning and saying healthcare data is what's important. It is, but so is other types of data, like the data for your financials for your company, your employee HR data, all that stuff is important. You still have to report. There are still fines for losing that data, right? So that's why we say expand your horizons. Think of the NIST. Next slide, Jake.
And
so what
Fred,
yeah, go ahead, John, please.
I'm sorry, I was just going to add there, the reason for the enterprise view or the holistic view is important because, breaches typically occur in something benign and then progress from there. So that's why it's important to make sure that you look at your systems holistically, because they typically enter through something small and progress through your network from there. So
absolutely. All right, so let's talk about these 5 steps. They kind of have a cycle that they recommend you follow. The first thing is identify. What does that mean? That means I need to know what I have. I need to know where my data is. I need to know where the systems that process and store that data are. I need to know where my medical devices are. What do I have out there? Those are the producers of EPHI, right? Medical devices do one thing aside from providing patient cares, they produce EPHI. Do we understand where all those systems are? Do we know where they are? All of these systems can be a launching point or something impacted by ransomware, right? So knowing what's out there, knowing where key data is created and stored is key to recovering, right? If something bad happens, I need to know I need to recover those systems. It's also key to protection. If I don't know what I have, I can't stop ransomware because I'm leaving some systems unprotected while I'm spending my time and effort really securing the ones that I think are important. But again, it's those ones on the edges that are the launching points towards the more secured systems that we have healthcare information and provide services on. So we want to look at the kinds of things to prepare, and that is identify the flows of critical information, do your security risk assessment, of course, HIPAA, because that's going to point out the risks. What is ransomware? Ransomware is an outcome, right? It's an outcome of someone taking advantage of some other part of your organization. So ransomware is what happens when you don't have the protective controls in place to prevent bad things from happening. That's what you learn from your risk assessment. You know where your holes are. If you can't manage those gaps, then you're opening yourself up to ransomware. So you can't prevent it if you don't know where those holes are. Of course, you need policies. You need to understand what is technically on the ground. So you need technical tools, vulnerability assessment tools, tools to identify your medical devices. Some of those devices are literally moving around your network on wheels. Some of them are attached to patients walking around the facility. You need to know where those sources of information are. And if they're cut off, what will happen if ransomware cuts off access and the function of those devices? And you need to make sure that you understand what your partners are doing. Just about most of the breaches that have happened in the last month have come through partners. One of the largest, as I was talking before this started, is a company called Professional Finance Corporation, one of the largest debt collectors for medical information. What did this mean? Well, they have thousands of clients, 650 of those were healthcare, 1.91 million patients affected. And because they had ransomware, every one of those 650 organizations now has to do a breach notification. That's catastrophic because we're not managing our partners and the risk of our partners. So remember, that is one risk of ransomware that doesn't even happen to us. It happens to someone else, yet it still affects us and we still have to do breach reporting.
And one example of that was Kronos. I don't know if anybody here in the audience was hit by the Kronos one, but Kronos is a timekeeping software. They got hit by ransomware, and that attack ended up impacting some healthcare organizations.
John, what do you feel about identify as the most important points to dig in on?
Yeah, I mean, certainly identification, understanding what your risks are and where it exists, it helps you put together a blueprint. It, most of this is not done overnight. It's an action plan that typically evolves into a multi-year strategy. And so having the ability to know what's the most critical and focus on those critical items. So biggest bang for the buck, right? This is where we're going to start. We can't take it all on at one time, but we're going to put together a strategy based on where the risk lies for the organization.
Fantastic. Jake? All right. We, of course, once we've identified our problems, we need to make sure that we're protecting our assets. So this is pretty explanatory. It's the safeguards, the controls we put in place. But what things are most important to think about when we're protecting for ransomware? Well, we certainly need to manage access. HIPAA is really all about access. But again, it's more than just worrying about whether somebody's looking at somebody's medical information or trying to access records that they don't want. Is somebody a bad guy who has now compromised somebody's system? Maybe somebody in HR has clicked on a phishing email and now their system is being controlled by a bad guy. Well, if we do not have access locked down, they're going to use that as a launching point to steal EPHI, to attack other systems, and eventually, if they get a foothold, to launch ransomware, right? So again, we need to know, can somebody in HR even get to a network with a medical device on it? Probably should never happen, folks, right? Maybe they shouldn't even be accessing networks that have any care function on them, right? So again, it's knowing what people can do, what differing roles in your organization have access to. The one I cannot stress enough is conducting regular backups. This is your number one prevention, or not prevention, another one recovery method from ransomware. And if you're going to do backups, you need to follow what is known as the 3-2-1 backup rule. It means you need 3 copies. You need them in 2 different types of media, hard disk and tape. Maybe it's, offline on in the cloud and tape. Maybe it's any combination of those. And one of those copies should be off-site. And what does that mean? Well, it means it can be an immutable copy in the cloud. In other words, there's no way to overwrite that. There's no function. It's been removed, the function to write to that backup copy. Or you're shipping them off-site. You're getting them off-site because it's not just the bad guys that'll erase them. A flood, a fire, all those things will ruin those backup tapes too if they're on site. So 3-2-1 backup rule it's being forced as a standard. You don't have an option any longer not to follow that rule. So I think that's probably the most critical thing. Patching, one of the top priorities. I think most people realize that's important. What a lot of people don't realize is when a critical patch, or excuse me, a critical vulnerability is identified and there's a patch released, the bad guys know that the fastest corporate America fixes things is 30 days, the next patch cycle. They know that that's the green flag. The race is on. They're on their way to find those on your infrastructure and get ahead of you and attack them before you can install that patch. So what I tell people now is if you have a critical severity patch exposed to the internet, you need to call an incident. That is an actual security incident. You need to drop everything. You need to find out your risk, probably patch that as soon as possible, because the fuse is lit. They're coming for you in a horde. Thousands, millions of them are coming for you and looking for that vulnerability. They see it, they will exploit it, and they'll probably use it to use ransomware. Critical point of what we're doing. Protect your network, understand what's going on, have visibility into your network, and train your employees, right? They're the first line of defense. That's the number one threat vector. Let's go through the people. So if you're not doing a great job training your employees, doing things like a phishing program, not a punitive one, but a program. It's not a single activity. That doesn't help. It's when you're helping people continuously over a period of time that you begin to gain the benefits of something like that. John, you've been in the trenches. Tell us how you've attacked all these things.
Yeah, I would echo the drumbeat around patching, and certainly in healthcare, 24/7, 365. It's hard to take systems down. Not every patch requires a reboot, but it typically does, which means taking a system away from patient care for a period of time. I think we all have negotiated windows for downtime where we do system maintenance and those type of things, and it's easy to skip that or put that off. But as you mentioned, the clock starts once a vulnerability is released, and we're moving more towards a world where we're experiencing zero-day attacks, so we don't have time to respond. So patching really is important. It's typically doesn't cost anything to patch. And so I would make sure that is prioritized. We could probably debate the number, but somewhere around 85% of vulnerabilities are mitigated through patching. And so you can see how important that would be. The other thing I would say here too is, you want to be able to, so you mentioned backups and the importance of those. And I would say here that practicing for an event would be important as well, to make sure that you build up that muscle memory, because you certainly don't want to be trying something for the first time in the middle of a crisis. And so, practice, ensure that you have playbooks, and make sure that you test and know that they work before you have to implement them in a crisis.
And so I got a question for you guys. So, patching sounds easy, but isn't. I'm looking at the audience here, and some of the organizations are large organizations like yours, John, and some are small organizations where they might have, one security person or just a few IT people. How do you manage it if you are a smaller organization versus a large organization?
Yeah, Jake, that's an unfair question. I wish I was in the audience listening to the response here. It's a very daunting undertaking. I mean, we're constantly being in large organizations, even small organizations. We have thousands of applications, and each one of those is constantly needing an update. If you have an iPhone and you look at how many of your applications on your iPhone need to be updated, it's constant, right? Unless you just take the easy button and set it to automatically update. We don't have that opportunity here, but certainly, getting some kind of routine and making sure that you're checking your applications for updates. You have regular maintenance windows where you apply those patches and those updates, because it's easy to get behind. And I've been in lots of organizations where you can get 3 or 4 revisions behind, and then it gets further and harder to do that. So to me, I don't have a good answer. I wish there was a magic wand I could wave on this, but it's something that you have to dedicate time and resources to, because like I said, it's important. And most of these patches fix vulnerabilities that are out there in the wild, so people can actively exploit those in your system if you don't patch them.
I'd add that one of the things you can do, even if you're a small organization, is put these into context. Vulnerabilities when they get reported, it's a severity. How severe is this? But that doesn't put context around it. Something that is a severe vulnerability exposed to the internet is red light and siren. That exact same vulnerability on a system back deep in your network that is maybe only on an interface that administrators with already have domain admin credentials can get to, that same thing becomes a medium at best if it's in that part of your network. So having the ability to do context, who can take advantage of this? Are they taking advantage of it? There's a new list that CISA puts out, right? Healthcare, you should know about CISA, right? It's one of the organizations you're reporting up to, right? CISA has a list now that will tell you, hey, go look and see, I see this vulnerability. Here's our list that tells you who's taking advantage of this, if this is actually something that's being used in the wild right now. So there are additional resources, and they're being pushed down to be used by small healthcare providers, by the government, saying this is an easy to use way to take a look and say, is this the top of the line? Do I drop everything to fix this? So they're trying to help. There's these things trickling down that are really meant for people on this call, on this webinar, to use as tools to help you get through some of that. Next slide.
And by the way, if folks are interested in trying to find those tools, you can email Fred, you can email me, and we'll make sure Fred, my email address is the easiest one to remember. It's just jake@criticalinsight.com. Shoot me an email. We'll get you the links for what Fred's talking about there. Go ahead, Fred.
Okay, detect. a sometimes forgotten about component of the security controls. We need to be able to know when bad things are happening. The sooner we know, the faster we can respond, the less impact that happens. So the thing that is going to minimize risk, because risk is a vulnerability and a person that's willing to take advantage of that. What is the probability of those two things happening? Somebody taking advantage of a weakness in your organization. So that's one component. The other component of risk is how bad can it be? What are the impacts, right? How bad of a breach are we going to have? So if things fail and we have to get to detect, this part of the risk equation is dropped away at this point. It's failed. What matters now is the impact component. That's the only thing we can control. John said it, fantastic statement, that if we're reading the instructions of the fire extinguisher while the house is burning, it's too late, right? We need to be prepared. We need to get ready to respond. As soon as that detection hits and says, we've got a problem, your team needs to be ready to respond as quickly as possible. So make sure you have the ability to have visibility into what's going on, into your endpoints, into your controls like antivirus, the firewall, data loss prevention, whatever tools you have out there. Know what's happening on your network. Is your IDS or your firewall screaming, I've got a bunch of data flowing out? That's very unusual because the volume is so much higher than normal. Have the ability to what's going on your network, PCAP, packet captures. In other words, having a network flight recorder or like a flight recorder in a plane that can replay all of the events, every single thing that passed the network and happened. This is incredibly valuable to understanding what's going on in your network. And being able to detect, knowing when an internal system is communicating out to command and control. It's either receiving information on attacking other systems, downloading new malware, sending out your data for extortion later, or sending in the command to go ahead and ransomware everything you own, right? So knowing that these are communications are happening are critical. And we commonly recommend, unless you're an organization that can stand up a 24/7, 365 security monitoring operations with 3 shifts and having staffed with security experts, which officially as of this year are the #1 most in demand position on the planet Earth, is the #1 position that we lack. Unless you are planning on staffing that and building that and having experts in that, outsource that component. It doesn't make sense to build something that is an entire unit of your organization that's going to do the monitoring when you're a healthcare organization. Focus on what you do best. Outsource these components, enable your internal security team to have a team to back them up and provide the services on a continuous basis. John, what else do you recommend in the detect component?
Yeah, this is certainly an area where I think is a good consideration for outsourcing this this component to people that do this on a regular basis and have the tools to do it. Our systems generate millions of logs. It's difficult to go through those. They generate a lot of noise. Do you really know what's normal behavior versus abnormal behavior? A lot of these exploits have particular signatures, so tools are very good at detecting those, but they become more sophisticated to try to hide those signatures to get past these tools that detect it. Having enough people in healthcare is virtually impossible. We want more people at the bedside and less people looking at logs, because it doesn't advance our mission in healthcare of taking care of patients. And so, this is an opportunity where, you forward those logs to companies like Critical Insight that do this stuff on a daily basis. They have, large capacity to review these logs, and the quicker you can detect and then respond, which I know is the next thing we'll talk about, but certainly the quicker that you can detect that something is abnormal, the better chance you stand at responding and mitigating that attack and stopping something from propagating across your network before it's too late. similar to what happened in West Virginia.
Yeah. I'd like to point out too that some of the statistics this year were very interesting, in that many health care organizations that were compromised with ransomware actually caught this midstream and were able to stop it before it got too far into their network. So those organizations had much better opportunity to recover than people who had their entire network. So again, it's that speed, right? It's knowing it's happening. Now I can respond.
And, Fred, I was just talking to a rural hospital that did get hit with ransomware, did have downtime, and it was very impactful, made nationwide news. Talked to them this week, and they said, if we had had the opportunity to see it quickly, we could have stopped it. And what they said was it was almost a full day from when they likely could have seen it. It was either 1 or 2 full days before they could, if they had the right everything in place, that they would have seen it, to when what they saw, of course, was on somebody's computer a ransom note. That's not the outcome we want.
I'm familiar with that situation, Jake, and I can also tell you what was also missed there was an opportunity to detect exfiltration of data. In other words, in a modern ransomware attack, they don't come in and just ransomware your data. They come in, they spend time looking at where your data is at. They then go after your backups to ensure they've encrypted or cut off or poisoned your backups. Once that's done, then they're going to focus on moving out as much of your sensitive data, patient data, maybe your financials. They're sending that out bulk as much as they can. Once as much of that data is extracted as possible, they execute ransomware. They've extracted that data because if you say, no, I'm not going to pay the ransom, they say, well, maybe you are, because we're going to publish your data on the dark web if you don't give us the money. So the opportunity I'm pointing out here is detecting exfiltration of large amounts of data. That is almost ubiquitous step at this point in a ransomware chain of events, that they're going to steal your data before they're going to ransom your systems. Detect that, and you're going to be able to get ahead of the whole thing. Yes, they will have stolen some data. Yes, they will still probably try to extort you, but they may not have stolen enough data to make it an absolute, existential threat to your organization. Okay, next slide, Jake.
And that reminds me, I want to say this real quick. I did talk to an organization where the bad guys did steal their data, but the only data they stole was their design files from their design team. So they stole a bunch of Photoshop files, and that's a good outcome.
Yeah.
So yeah.
All right. What does it mean to respond? Response really starts in your plan. An incident response plan. What does an incident response plan include? A lot of places we go, we see it's a call tree, not a plan. Sorry, folks, not a plan. A plan is a framework for responding to things. There should be probably a policy that defines what is an incident, because the plan itself shouldn't define it. It should be an incident management policy that says, this happens, we call an incident. We break out the incident team. An incident response plan should have the actions that you're going to take, both at a high level and for very specific situations at a detailed level. Things that John mentioned, having playbooks. You should have at minimum a ransomware playbook. It should include everything that you're going to do in stepwise order, spelled out. That may be a branching tree. For example, make the decision before it happens whether you're going to pay for a ransom. If you have not already made the decision at your organization on whether you pay ransom or not, you're going to be caught red-handed, or caught, what's the term, you're going to caught with your behind the 8 ball if you do not have that decision made ahead of time. Nobody wants to go to the chief medical officer and say, hey, should we pay this ransom so you can go back to work and start helping with patient care? Those decisions need to be made. There may be some limits on what you're willing to pay, and your cyber insurance is a critical component of whether you will pay what their decisions are, and what they're going to pay you for. All these things are not, it's not a bunch of technical stuff necessarily that we're talking about. It's some management decisions that you need to have made long before these things happen, right? And then you need to do tabletop exercises. I will tell you, we do tons of these for healthcare. I get thank you letters literally from chief medical officers who have never been brought into this before and are realizing how utterly critical their role is. And it's not a bunch of technical IT folks talking about bits and bytes. It's making critical decisions about patient care. So when you're doing these, it includes everybody. It includes CEO, legal, compliance, communications, the CMO, all the IT team, and all the responders, right? So make sure that people have developed this muscle memory. And I said, yeah, and make sure everybody's included. That's really the key, because in a response, it is truly an all hands on deck. And there are certain decisions that are incredibly impactful that if you're thinking about it for the first time, that's tough, right? You don't want to be in that situation. John, you've probably been here. Tell us what it's like.
Yeah, and certainly, again, echo the statements earlier that it's important to have practiced this when you're not under duress, to have those playbooks that you can rely on to make sure that you have everyone in the room. A lot of people, I think, typically don't think about having marketing in the room, but you certainly want to message and manage the message that goes out and into the public. And so, there are things like that you just want to make sure, and under stress, you don't always think about including those folks. So tip my hat to you there, Jake, in marketing. But certainly, over here on the slide to the left, HITRUST, Cyber RX, we're talking a lot about NIST, but HITRUST was specifically written as a framework for healthcare. And so that might be a good place to start when you look at those tabletop exercises and things that you might want to make sure you have in your muscle memory. And you mentioned key decisions and things that you should talk about before. Certainly, whether your organization is going to pay a ransom or not is an important thing. A lot of organizations, because ransoms are typically paid in Bitcoin, go out and secure that ahead of time, because that's something that takes time to do if you've never done it before. So these are things that by practicing and walking through them, you're prepared if and when something does happen.
Yeah. Another thing I'll toss in, there's some things that people don't think about when they're thinking about kind of this respond component. Well, one of the things you have to do, and probably should be mentioned in kind of earlier phases, is things like having an offline domain controller, especially if you're running an on-premise organization. You should have a copy of your domain controller running offline and syncing a couple times a week, because if the bad guys take over everything, the one thing, if they get a hold of and they kill your AD, you're looking at a 3-week rebuild with nothing working. If you have an offline domain controller sitting right next to it, you flip a switch and you're back, right? These are the kinds of things you need to get ahead of, right? So these are the kinds of things you'll rely on in a response, right? Hey, we lost the domain controller, shut that one down, shut everything off, change all the passwords, let's bring this one back up. We're back in an hour, right? So these are the kinds of things that, again, it's responding is all about preparing effectively, right? Knowing what you need to have in place.
And Fred, so as again, I'm looking in the audience here, and I see some very large organizations, and I see some smaller hospital districts. For developing an IR plan and keeping it updated, and then using it to do tabletop exercises. For a big organization, a small organization, do you, Fred, suggest that they update it every year? Do you have different suggestions for different size organizations?
Yeah, so I would say a minimum of once a year. One reason, your playbooks are quite likely to change. The last couple of years, they've been pretty consistent. It's like business email compromise, malware on an endpoint, ransomware, the system beaconing out command and control, right? Those are pretty standard, but there's going to be new threats, and you're going to need new playbooks, and you're going to need to adjust what happens. Remember, technology in the back end changes. If your backup technology changes, either the interface changes or the whole technology changes, you need to rebuild all that because speed is of the essence. Those playbooks should say, press this button in the backup software, next press this button, right? It should be a cookbook to get through that. So that stuff needs to be updated, but also the threat scenario, just getting together and doing tabletops with the scenarios that you're most commonly expected to face, right? So you need to drill on what, frankly, what you didn't do so well in last year's tabletop, you should redo and get better at, and you should add new things that talk about new threats. Because your tabletop is an opportunity to say, in the last year, this is the most important things that hospital and healthcare have faced. Let's build a tabletop exercise that leans into these threats that are most current, most common, and basically go out. And when we do this, if we're doing it for people, we literally go out and pull little indicators of compromise the day before we do this for real life bad guy teams, that when we throw it into the tabletop exercise, the IT team can literally go and look up and say, yeah, today this is Hive Group. Hive Group is probably the most active healthcare ransomware group in America or in the world today. They're out of North Korea. They're responsible for a bunch of the things we talked about earlier today. So knowing what Hive Group is doing and how they're attacking your organization should help you design a better tabletop and a better incident response plan. All right, recovery. Recovery, can't not stress how important it is to have that recovery muscle built up. We talked about the plans and the playbooks. Well, those are the things that guide yourself through the recovery process. Knowing all the components. Do we pay ransoms? We talked about how important that is. John talked about Jake and the communications component. When we're talking about communications, we want to make sure everybody knows there are multiple communication streams you need to manage. There is potentially a public communication that goes out to the press. There is government communications for breach notification and things like that. There is communications to your vendors and potentially to partners you're working with. There are communications that may go out to all internal employees. There may be communications that go out to a subset of internal employees, and a communication set that may go out to investors and the board of directors. All of these need to be critically and tightly managed in these events, because if you're communicating incorrectly, many things happen. One, you may be accused of being not forthright, and plenty of companies struggle with that, even though they're probably trying to do their best. But you also run the risk of creating misperceptions, creating opportunities for lawsuits, and creating the internal feel that things are in a state of chaos here at healthcare company XYZ, and you do not want that to be the outcome of a bad guy event. So managing those communications, again, a key component of this, and knowing who all the stakeholders and the audiences are for those communications. You mentioned, Jake, making sure your IR plan is up to date. It's equally important for your disaster recovery and business continuity plans to be up to date. What in essence are you executing when you say let's recover from ransomware? First half is information security IR plan. Second half is almost identical to the DR plan, right? It's how do I recover from backup, right? So making sure those plans are up to date is critically important. And if you think about what ransomware is, if you have your entire organization has been compromised, it is no different than a fire in the data center that burns everything down, or a flood that destroys all the systems. You got to rebuild from scratch. You got to build from the ground up again. That is identical to what you're going to find in your DR business continuity plan. And this should be part of your business impact analysis statement. If you're doing that for your organization, you should be including these risks and these potential outages, right, in that business impact assessment. And cyber insurance. So let's talk a little bit about what it means to be ready for cyber insurance. Cyber insurance has changed probably more in the last year than it has in the last 20. That is because the cyber insurers have now had their clocks cleaned by the number of ransomware events that have happened. They've had to pay out they're actually losing money in this space right now. When you're losing money, what does that mean? It tightens up the requirements to get cyber insurance. There are plenty of requirements now that says you must be this tall to ride, this tall to get our cyber insurance. If you do not have things like multi-factor authentication in place, if you do not have things like a vulnerability management program where you're scanning and patching vulnerabilities, you may not qualify for this. Well, the number one way to transfer risk for ransomware is through cyber insurance. So it's a critical control for your organization to have the ability to get cyber insurance, and secondarily, to get and qualify for a policy that covers the elements that would include ransomware, because you need to be careful. There are some nuances to how the policies read and what they cover. You need to make sure you understand that. And you need to make sure that you understand what does it mean if one of your suppliers gets ransomware and it's nothing you can control, but still it ends up flowing uphill to you because they're a business associate of yours. The trouble flows uphill in HIPAA, and you end up having to potentially make a claim on something that didn't even happen on your. Is that even possible, right? You need to understand that. You need to cover that eventuality that even though I have cyber insurance for ransomware, may not cover me because it happened to a partner of ours that had our data, right? So it's a complex issue. John, again, what has your experience taught you here?
Yeah, a great information, Fred. I would echo a couple of things. One, certainly understand the regulations that affect how you respond to ransoms. For large organizations that may be multi-state, the regulations can vary by state. So understanding what those requirements are is important. And you mentioned public relations, and certainly the value and the damage that can occur to your brand. So managing and making sure that you're ready to respond to that and put that message out, because if you do have to report, it will make the news. Healthcare is very sensitive, and so it will make the news if you do have to report publicly. So make sure that you're ready to respond. And then, I would say from a cyber insurance perspective, I know we used the term on the slide to consider cyber insurance, but I think that is probably more mandatory than a consideration. Again, these numbers change all the time, but the cost of a breach can be somewhere between $300 and $400 per record. So that can add up very quickly, depending on the size and scope of a breach. And cyber insurance may not cover the entirety of the cost of a breach. And so you want to make sure that not only do you meet the escalating requirements of cyber insurance, as Fred mentioned, but that you have enough coverage to cover the amount of records that you might have in your system. And,
yeah, I mean, and John, to that point, there was a hospital I was talking to at the American Hospital Association conference, and they got hit by ransomware, and insurance covered. They did have insurance, and insurance covered about 60% of the costs. The problem is that the attack was, I think, the whole thing cost them $12 million. So, they ended up out of pocket several $1 million because insurance just didn't cover everything.
Yeah, that's really painful. I also want to mention too that we're entering a little bit of a new space. The very first death by ransomware suit has been filed in the United States for an Alabama baby that passed away from fatal brain damage because the heart rate monitors failed during a ransomware event. If we start seeing these types of potential tort style or even potential criminal lawsuits for patient injury, this whole horizon may change for us. So we are entering kind of a new era where some new law and precedent is going to be set, and it's going to dictate really what the risks to us are from a legal perspective here too as well. So what Jake has popped up here, just to tell people what really is the entirety of the NIST cybersecurity framework. It's a set of things that we look at, areas of controls that help you to put together a comprehensive view, as John mentioned, of your enterprise security. It's really meant to look end to end. Everything you have, everything that makes up a potential risk, threat, or vulnerability in your organization should be taken advantage of. What I will tell you though, it is a great framework for one reason in particular. It is not prescriptive. There are plenty of requirements that say you will do it and you will do it this way. This is not how the NIST cybersecurity framework is built. It is built with an outcome in mind. In other words, if it may say, we want you to have an effective vulnerability management program that identifies vulnerabilities on a timely basis and follows up to ensure that those risks have been mitigated. That's an outcome. And how you do it is up to you. And that's great for healthcare because like HIPAA, which gives you the ability to do risk analysis to determine what's most important to do and where you should spend your precious money. This is also built the same way in that you're allowed to take it and say, how do we solve that with our budget, for the size and character of our organization, for the security threats we face? What's the best way for us in a small rural hospital, for example, to cover what would be done very differently at a multi-state hospital chain with 25 hospitals in it? So that's why we like this. It's flexible. It's not going to put you in a corner and tell you how to do it. It's going to tell you what you need to achieve. And that's one reason we really like this as well. Okay, how do you connect the NIST cybersecurity framework with HIPAA? Because most of us already built and have annual HIPAA risk assessments here. So there's an exercise called crosswalking where you can take one standard and you can say, and how does that compare to my compliance in another standard? It's real easy to go out and grab these. The government produces them. There's a couple companies that will do these for free just as a service for you, but you can take and crosswalk HIPAA to NIST. So if you've already got HIPAA, crosswalk it to NIST. If there's some areas that are still gaps, fill those in. And that's that stuff I was telling you. HIPAA is going to be very focused on EPHI. NIST is going to be very comprehensive. So when you crosswalk these, you can find those intersections where the data is the same or the controls and findings are the same, and areas where you need to fill in the fringes and make sure you get a complete picture of what's going on. So here's a couple great resources there for you as well.
Yeah, and we'll make sure you get the the folks at the council will make sure you get the deck. And I just want to give people a sense of what we do here. So we talked about managed detection response, that 24/7 coverage. We actually see it wider than the SOC as a service. We see it as that incident preparedness that Fred talked about and John talked about with the response planning, building that IR plan, and then obviously active incident response. We hope you don't get there, but of course we're there for folks. And then on the right is the strategic program development. So that's building the policies, that's the penetration testing, the vulnerability scanning, and the security assessments that we talked about that are key. That includes the HIPAA security assessments. And so, the customers who we work with typically take advantage of multiple services and treat us as cybersecurity as a service. They don't have teams of 20 or 30 security individuals, and so they look to us for help in elevating their entire security posture. And then some bigger organizations use us, for example, for tabletop exercises or IR plans, but smaller organizations take advantage of more. They simply don't have all of the people to do all of these things. And one other thing I just want to tell people about is we do security awareness training for free every other Friday. If you go to our website, criticalinsight.com, and click on the events section, you can sign up. Nurses, traveling nurses, I know are are always coming in and out. Happy to have them in our security awareness training. And if you want to get in touch with us, their email address is Ellie works with us and can get anyone in touch with anybody. And we answer 800 number anytime. And I want to toss it back for questions if there are any questions that came up.
Yeah, thanks, Jake. This wasn't really a question, but a comment. I thought it was a good comment. I'm going to throw it out for y'all's feedback. Air gap in using air gap, especially in recovery, related to doing your backup and protecting it. Any thoughts on that? And do you think that's something we could explore?
So I'll jump in on this one. There's a new kind of entry into this space, and I mentioned the term. It's called immutable backup. It is built on the concept that whatever we're trying to achieve with air gap, in other words, so bad guys cannot attack my backups, they're air gapped, they're separated. That is really the concept behind the 3-2-1, in particular, that one copy that's off-site. It's the concept of a very large air gap, frankly, right? That's involved there. But the way to kind of not necessarily have to go that road where you're shipping tapes or making sure you're uploading to a cloud and you've got an offline copy up there, is to use this immutable backup concept, where the backup vendors have built into their technology in response to the ransomware risk that once this is written to these backup, the backup media that they have, it cannot be changed. Is that a perfect solution compared to rotating the offline backups? Maybe. It is possible to poison backups on the client side on key systems. So what they're sending up is garbage. Okay, so that is a challenge, but that's going to happen in any system. Moving off-site and air gapping them is not going to protect you if they've decided to kill the backups at the source, if you will. But the air gap concept is built into the 3-2-1 rule that I'd mentioned. I would really lean into that because CISA, for example, we've been proponents of this for 5 years. CISA now is saying that they're going to call that a basic requirement that people follow the 3-2-1. And that came out this week. I believe that guidance came out this week, along with the update of HIPAA. In case you folks don't know, there's a update of HIPAA right now going through the comment period, and that could have some impacts as well.
Thanks. We got a couple of questions, and I'm going to kind of combine them. All of you know, because you deal with hospitals, salaries, wages, benefits, contract labor have skyrocketed. We have got a lot of supply chain issues that's impacting the price of supplies, etc. The point I'm making is hospitals, especially rural hospitals, have got very tight budgets and have had big expense increases. What are your thoughts on what is a percent of budget that should be spent on cybersecurity? And more importantly, what are your tips on how you get the executive management and board to understand the cost associated with cybersecurity?
John, why don't you jump in here? I'll throw the hard ones to you.
I appreciate that. We certainly have our challenges in healthcare these days. I know at CHRISTUS, our top cost is contract labor, not any different than anywhere else across the country, and certainly doesn't look like it's going away anytime soon, nor do the supply chain issues. So, to specifically answer the question, I mean, the benchmark number is typically 4 to 5% of annual revenue that you would target to spend on security. And again, that can be a big number. That's something that is daunting. There are a number of things that organizations can do that mitigate risk without spending dollars. So, we mentioned patching as an example where you don't have to spend any money typically to patch a system. That just requires time and effort. There's the principle of least privilege, so practicing not giving people access to things they don't need access to. It takes a little bit of effort, but it doesn't cost any money to do that. Most drives these days have the ability to be encrypted, so just turning on encryption on those drives by default. Again, very little, if any, cost to that. So there are things that organizations can do to mitigate risk without spending dollars. But in the spirit of the answer or the question, typically it's a 4 to 5% number that you would target. Jake, anything else you would add to that?
Yeah, the trick is getting that, especially rural hospital boards, to understand how important that is. We do a lot of outreach to rural hospitals. Jake just got back from the Rural Hospital Association annual meeting. We're trying to educate them. We're working as hard as we can to help them to understand the risk. What I would suggest you do is clip headlines about all of the similar hospitals or healthcare organizations just like yours that are getting crushed, because literally, if you Google once a week, you'll find 1, 2, maybe 10 that you can forward up to them and say, this is how it works. When people change, when it happens to their neighbor, right? You can tell them a million times. When it happens to the person they know next to them, all of a sudden it becomes real. Help them make this real, because it is. I mean, this used to be a hard sell 20 years ago. When I was on the road trying to sell risk assessments, it was a hard sell. It's not a hard sell anymore. Everybody's suffering. So just help them to understand that, because a lot of them don't understand that still, that it's going to happen to everyone. No one is immune anymore. Full stop. Right. So it's prepare. Make sure you're prepared for this bad eventuality. It's going to happen.
Here's another question. What is your opinion on using ransomware simulators to find security gaps, or should you only rely on using patch management and vulnerability scanning?
So I'm going to go in the middle of that, and I'm going to say you certainly need your vulnerability management and patch management programs. I think the best thing to do after that would be something like an annual penetration test, because that's where you're going to take the human, who's somebody who is trained on all the same literally the same tools and techniques that a hacker uses. If you read what's being used most commonly out there, it's the same toolkit that our offensive security testing team uses, and have them come in and have them test you in a real world situation and try to prevent the gaps before they happen. Ransomware simulators have a hard time with the concept, because again, ransomware is an outcome. That's what happens when your defense fails. When they take advantage of a vulnerability, the outcome is ransomware. So the term has a little bit of dissonance for me, because really what you want to do is find out how to prevent this and then make sure that you can recover. And those are tabletop exercises for your IR plan and disaster recovery plan. So I lean into what I think are more standard high value approaches to that.
Great. And here's another question we've got. Can you explain the difference between endpoint detection and response and managed detection and response?
Absolutely. So managed detection and response is a broad field that speaks to monitoring of any number of sources. So that could be the network, could be endpoints like EDR, endpoint detection and response. So that's a feed up into MDR. It could be your cloud information, could be coming from applications, right? All this information flows into some central source. Detection happens. So there's the manages that somebody's you've outsourced this to. Detection happens, and then a response of some kind happens. Anything from here's what you should do, advice, to actually quarantining systems, to deploying an incident response team out to the client to fix things. So that's managed detection and response. EDR, endpoint detection and response, is a technology. MDR service, EDR technology. So it is the technology that you put out on endpoints that allows you to monitor what's happening out there and to take action. And you heard me say like isolate or quarantine a system. That's a common action that EDR technology allows you to take. In other words, I see bad things happening. It's talking out to command and control before it starts sending out more data, before it starts attacking other systems and starting ransomware. I'm going to isolate that system immediately. Can't communicate with anybody else. We're going to go investigate it, but it can't do any harm in that state, right? So that's what endpoint detection and response gives you. So think of endpoint detection and response as something that would feed managed detection and response type services or offerings. And some people are starting to use a new buzzword called managed extended detection and response, MXDR. We're not playing in that space. Frankly, we meet absolutely every requirement. It's kind of a marketing term. We're not enamored of it. We may jump on that bus. We do it. We just don't think it's really descriptive of what's going on, right? We want to tell people exactly what we're monitoring: cloud, EDR endpoints, the network, right? All that sort of thing.
I think our time is running low, and I think that was our final question. But Jake and Fred and John, we can't thank you enough. Excellent presentation. But before we close, Jake, do you have any final thoughts or any final comments?
I do, and I want to thank everybody for joining us here today. You know, I want to indicate just, you know, how infuriating it is when something goes wrong, and when ransomware gets into a hospital system. You know, we're here to help folks defend. We're here to help folks protect. We're here to help folks, you know, solve this problem and bring down the risk. And obviously, if folks want to get in touch, you know, you can send us a note, or you can do it through the council here. And we really want to thank you all for having us here today.
Well, thank you all very much. And to the people that are attending, we thank you. And Chris will have this recording available, what is it, early next week, Chris?
Yes.
Yeah, early next week. And all the folks that are registered will get a copy. So thanks to everyone, and please have a safe and enjoyable weekend.
Thank you.
Thank you, everyone.